Welcome. Today, we're jumping into some really cool medical detective work. It's all about how a group of researchers found a much smarter and way cheaper method for catching a health problem that's super common but often flies right under the radar.
So, let me just start by asking you something. Have you ever had those days, or maybe even a string of weeks, where you're just feeling completely drained, tired, a bit foggy upstairs, and you can't really figure out why?
Well, it turns out the culprit could be a really sneaky vitamin deficiency. And the reason it's so sneaky is that its symptoms are super vague, making them incredibly easy to just brush off or blame on, stress or a bad night's sleep.
And that brings us right to what we're calling the B12 deficiency puzzle. We're going to explore exactly why this condition, which is actually pretty common, is so incredibly hard for doctors to diagnose with any certainty.
See, here's the thing. A doctor might look at your symptoms and think, this could be low B12. But going from that suspicion to an actual confirmed diagnosis, well, that's where it gets really, really tricky.
A huge part of the problem is this weird gray area called subclinical deficiency. This is where your B12 levels aren't technically low enough to be flagged as deficient on a lab report, but you're still feeling all the symptoms. It just makes getting a straight answer a real headache.
So all this confusion leads to a pretty expensive diagnostic dilemma. There are some real barriers, both in cost and accessibility, to getting a clear answer.
Okay, so take a look at the diagnostic toolbox doctors have. On one side, you've got these advanced, specialized tests. They're expensive, not every lab can run them, and sometimes they can give false positives. But on the other side, you have the standard complete blood count, the CBC. This thing is cheap, it's available everywhere, and millions of us get one pretty much every time we see a doctor.
And this leads us to the absolute game-changing question that got this whole thing started. What if the clues weren't in some fancy, expensive test? What if they were there all along, hiding in plain sight, and the results of our routine blood work?
That one question sparked a search for some simple clues. A team of researchers in India decided, hey, let's go back and re-examine all this everyday data and see if there's a pattern that everybody's been missing.
And their method was just brilliant in its simplicity. They just took the existing lab data from 100 patients and started digging. They looked at their normal CBC results and their bilirubin levels, hunting for any combination of clues that pointed towards low B12.
Now, to really get what they found, we need to know the 4 clues they were tracking. First up is MCV, which stands for mean corpuscular volume. It's basically just a measure of how big your red blood cells are on average.
Next, there's MCH, or mean corpuscular hemoglobin. This one measures the average amount of hemoglobin, that's the super important protein that carries oxygen, packed inside each of those red blood cells.
The third clue? Platelets. You probably know about these. They're the tiny little cells in your blood that help you form clots when you get a cut. Well, it turns out that a B12 deficiency can sometimes make your platelet count drop.
And the final piece of this puzzle is bilirubin. This is a substance your body makes when it breaks down old red blood cells. Because B12 deficiency can mess with red blood cell production, you might get more cells breaking down, which in turn raises your bilirubin levels. It's another potential red flag.
So here's the breakthrough. Any one of these markers on its own isn't a perfect indicator. But what these researchers found was the winning combination. These 4 simple markers, when you look at them together, create an incredibly powerful screening tool.
And here it is. This is the simple checklist they came up with. A patient gets a flag for possible B12 issues if any one of these 4 things shows up in their routine labs. If their red blood cells are too big, if they have too much hemoglobin per cell, if their platelet count is too low, or if their bilirubin level is a bit too high.
Okay, that sounds amazing, right? But the real question is, does this simple checklist actually work? Well, let's take a look at the numbers they found. First off, sensitivity. The test had a sensitivity of 68.2%. Think of it like a smoke detector. This means it correctly went off for nearly 70% of the patients who actually had a B12 deficiency. It's pretty good at spotting the smoke.
Then you have specificity, which came in at a really impressive 85.7%. To stick with the analogy, this is the smoke detector not going off when you're just making toast. It correctly gave the all clear to over 85% of people who did not have the deficiency, which prevents a ton of false alarms.
And finally, we have the positive predictive value, which was almost 79%. This number is huge. It basically means that if this screen flags you as possibly deficient, there's about an 80% chance that it's right. That is a really strong signal.
So what does this all add up to in the real world? Well, it means we have a way to do cheaper screening, which could lead to much better health for millions of people.
And this is the part that is so important to get. This checklist isn't meant to be the final diagnosis. Think of it as a really smart, low-cost filter. It gives doctors a powerful way to decide who actually needs to go on and get those more expensive, specialized tests.
The researchers themselves said it best in their paper. They wrote, "This would result in a significant decrease in health cost burden and is especially advantageous in developing country like India. This isn't just a clever scientific finding. It's a practical solution with a massive global impact."
And all of this leaves us with one final, really powerful question. It just makes you wonder, what other incredible health secrets are hiding out there in plain sight, buried in our routine medical data, just waiting for someone to ask the right question?